Please download it. Please download all requirements are
download it.
download it അല്ലേ all you will get all requirements
ആദ്യത്തെ ഒരു സാധനം കൊടുക്കട്ടെ. ഗുഡ് ആഫ്റ്റർനൂൺ ഓൾ. വി വിൽ സ്റ്റാർട്ട് അവർ സെക്ഷൻ വിത്തിൻ 5 minutes.
live class
ഒരു മിനിറ്റ് ഒന്ന് ഓൺ ആക്കുവാണ് കേട്ടോ. ഓൺ അല്ല, തുടക്കത്തിൽ ഇതൊന്ന് പറയട്ടെ. ഗുഡ് ആഫ്റ്റർനൂൺ ഓൾ.
Good afternoon, all. We'll start our section within 5 minutes.
എന്ത് ചേച്ചി എല്ലാത്തിനും
ആക്ച്വലി ഫസ്റ്റ് അത് പറയുന്നതിന് മുന്നേ എല്ലാവരും കേൾക്കുന്നുണ്ടോ എന്ന് ചോദിക്കണം.
ഓക്കെ. Am I audible? If when class is started,
Inform or message on the card.
any trouble regarding this?
25 അല്ലേ
33. Any trouble regarding the
വീഡിയോ ക്ലാസ്സസ് ലൈവ് ക്ലാസ്സസ് അല്ല ഇല്ലാണ്ട് വീഡിയോ ക്ലാസ്സസ് ഉണ്ടല്ലോ. ലൈവ് ക്ലാസ് ലൈവ് ക്ലാസ് ഉണ്ട്. ലൈവ് അല്ല ഇത് ആ വേണ്ട ലൈവ് ക്ലാസ് വീഡിയോ ക്ലാസ് സോൾവ് ക്വസ്റ്റ്യൻ ബാങ്ക് സോൾവ്
any of the students
അതിന് ലാസ്റ്റ് പിന്നെയും നമ്മളോട് പറയണ്ടേ.
introduce subject expert reading give her a warm welcome and
Please download
so that I will give you one important thing needs to be considered is that please mute your microphone and use the chat box for inquiries and questions. Also, any trouble regarding the study, inform us. മുപ്പത്താറ് പേരായി. അപ്പോൾ 5:05 തുടങ്ങാണ്. Pressing note, download the nursing syllabus. തുടങ്ങിയാലോ? 5:05.
ഷുഗർ റെഡിയാണെന്ന് ചോദിക്കും.
ആരാണ്ട് ടോപ്പിക് മാമാണ്. ആരാണ്ട് വണ്ടിയൊക്കെ എടുക്കുന്ന സംഭവം.
നീ പറയണേ ക്ലാസ് തുടങ്ങുന്ന സമയത്ത് എല്ലാവരുടെയും മൈക്ക് മ്യൂട്ട് ചെയ്തിട്ട്
തുടങ്ങിയാലോ?
എല്ലാവർക്കും ഓഡിബിൾ ആണോ
അഞ്ചായി തുടങ്ങട്ടെ. എക്കോ അടിക്കൂ.
Good evening, all, and welcome to our exam preparation class. And this class is mainly concentrating on GNM students. And if there is any BSc students, don't worry. This section is also very helpful to you. My name is Avina, and I will be your host for today's section. And it's my pleasure to introduce Ms. Shubha, subject expert, leading today's section. Let's give her a warm welcome and let's get started. Before that, please note it, please mute your microphone and use the chat box for any queries and comments. And any trouble regarding the audio, you can also message in the text box. Is it clear for all? So can we start? Can we
হেল্ল'।
start? Are you ready?
শুনা না, মই মানচিত আছে, মই সবিতাই কৈছো। অকে, আইচিউত আছো। যদি পেচেণ্ট আহে মোক ফোন কৰি দিবা দেই 306 306।
Sorry, once again I repeat, please mute your microphone and use the chat box for any queries and comments. Sabida, please mute your microphone. Okay, can we start?
കാണാമോ? PPT കാണാമോ? ആ പുള്ളിക്കാർക്ക് അറിയത്തില്ലല്ലോ. ഇപ്പം വിളിച്ചു. ഞാനോ? ആയോ?
Once again, I welcome Ms. Shubha, subject expert, leading today's section. Let's give her a warm welcome and let's get started.
ആ PPT മൊത്തമായിട്ട് കേട്ടോ.
Hello, good evening all. I hope you all are doing good and wish you all of the Ganesha festival. In today's session, we are going to discuss regarding the nursing exam preparation for GNM students, that is for 2024 batch. Okay, I think you all worried about how to write the exam because this is the first time you are going to write the exam, right? So first you have to know how to write the exam, how to manage the time, and what is the syllabus, and how much marks they are going to ask. Everything first you have to need to know. So in today's session, by one, I'm going to discuss regarding how to manage the time, how to write the exam, and how to pass your nursing exam in easy way. Okay. So coming to the first. So I am discussing here the nursing foundation subject. So the marks of nursing foundation subject is for 75. Okay, and 75 marks for writing and 25 marks for internals. So in nursing foundation subject, it involves fundamental of nursing and first aid and nursing foundation practical. So you have to focus on fundamental of nursing subject and first aid subject and practical also because the practical exam is also important for you peoples. regarding marks, so there will be total marks for 100 marks. So you have to score 100 marks for passing, right? In that 25 marks is a internal exams. So you all writing, I think in your college they will conduct three internal exams. So by the three internal exams, they will give you like 23, 24, 25 marks, and they will consider the attendance also. So by considering your attendance and by considering your internal marks, so they are going to give the marks by the college teachers. So that marks is for 25. And the next one, you are going to write the exam for 75 marks. So you have to write the exam for 75 marks, and the practical marks is for 100. So 50 marks will be internal. Same. The 50 marks will be given by the college, because I think you all know regarding the clinical postings. So you will be posting for clinicals, and there will be the clinical attendance and exams. So you all getting the 50 marks by your college side. And the 50 marks you have to write the exam that is in the clinicals. So they will send you for the hospital and they will give one patient case, and you have to write the exam for 50 marks. Coming to the tips, I think everyone wants to know regarding the tips for nursing exams, right? So without tips, you can't get passed in the exam. So the tips for nursing exam is the sheet management. So what do you mean by sheet management? So you will be like, you have to know how to manage the sheet, how much answer you have to write. For example, if they are asking only one marks question, so how much page you have to write? You have to know that, right? So some students will be there for asking one marks question, two marks question, they will write 2 page, 3 page. So that is waste of sheet also and waste of time also, and you won't get the marks. So you should know the sheet management. For example, for if they are asking only for one marks question, you have to write the answer only in one line or two line. That is enough. So not maximum 2 page or 3 page. Okay, that is about sheet management. For 5 marks questions, you have to write 2 to 3 page. That is enough. For 1 marks question, one line or two line. And coming to the next thing, you have to read the question properly. So that is very much important, right? So if you are understanding the question first, then you can write the answer. So you can write the answer by your own sentence also if you understand the questions. So first you have to read the question properly. So sometimes what they will do, they will make a confusion. Like, so same questions will be there, but you are going to get confusion and you are writing the answer for different questions. So that is the things happen for so many students. So first thing, you have to read the question properly. And when you are in the exam also, they will distribute the question paper, right? So after distributing the question paper, don't start the answer immediately. Don't start to write. Okay, first spend some 5 minutes or 1 to 2 minutes to read the question properly. So sometimes the spelling mistake will be there, and sometimes the question mistakes will be there. So you have to identify that, and if there is any mistakes in the, so you can inform to your invigilators. So that is the thing you have to do. So first you have to read the question, then you have to start to write the answers. And the next thing is the marks management. Right. So if you are considering the marks, for example, if there is a 5 marks means you have to write the answer for 5 marks only. But what the students are going to do, for 2 marks questions, they will write definition, cause, management, diagnosis, evaluation, everything. That is waste. Right. So for 2 marks questions, you have to write the definition. That is enough. So marks management is very much important. So coming to the next one, time management. So everyone is facing the time problems. So as when I was the student, same thing, I also was facing the same problem in the time, because we are having small time, but we have to need to write the long answers. So we know the answer, but we can't write the answers because of time. The time is very short. So within the time you have to write the answer. So first thing you have to learn that. Okay. So you have to learn by practice. So some students will be there, they know the answer, but their handwriting will be very slow. They are writing too much slow. That is also made the cause of their failing exams. So that students what they have to make every day they have to write one sheet answers. Like they have to manage the time and they have to learn to write first. So they have to practice speed writing. If you are writing speed means so they can understand. So that is one thing you have to manage. So the time management is very much important. And coming to the attention to question papers. So you are reading question paper and you have to manage the time. So some students will not see the time, so sorry, marks they will not see, and they will start to write the answers, and question they will read mistake, and they will start to answer different way. So that is all the things you are going to suffer during the exams, because during the exam all you will be having like stress, you will be having like nervous. So because of the tension and nervousness, what you people are going to do, you will make a mistake. Like you are reading the questions mistake, you will understand the questions with different manner. So this is all the things you have to avoid during your exams. So first you have to be in the patience. Okay, don't get any tensed or nervousness. So the next thing is question number and serial orders. So while writing, what you will do, you will forget to put the question number. Okay, so if you are forgetting to write the question number, if you are writing the answer, then also they will not consider for the marks. They won't give any marks for the questions. So if you want marks means first you need to put the question number and you have to start the answers. But some students, they will write the answer first and later they will try to put the question numbers. That is the wrong mistake that is done by the students. So while you are writing any answer, first you have to put the question number. Okay, first you have to see the question properly and you have to see the number, serial number. If the question number serial is 1, you have to mention 1 only. If you are mentioning 2 also, that will also cause wrong, right? So this is the thing you have to keep in your mind. So this is the mistake done by so many students, that they will write the good answers, but they will forget to write the question number. Okay, and the last thing you have to write the diagrams for anatomy and physiology. You have to practice to write the neat and tidy diagrams. So it should be attracted by the evaluator, because if you are writing good neat diagrams, they will be attracted by your diagrams and they will give the good marks. So inside they will not read the points. So main thing in anatomy and physiology, like you have to focus on the diagrams. Okay, so you have to write neat diagrams with pen or pencils. So this is the tips of nursing exams. So one is sheet management, and first next one is read the question paper properly, and you have to manage the marks and the time management. And the next one is attention, and you have to put the question numbers properly and you have to write the neat diagrams. Okay, so when you are entering the exam hall, you should be know regarding these points and you have to be keep in your mind regarding these things. Okay, so coming to the next thing, coming to the syllabus. Okay, what are the syllabus involved in the nursing foundation subject? So in the syllabus, the fundamental of nursing syllabus is different and the first year syllabus is different. So let us see which are the topics, which are the chapters you have in the fundamental of nursing syllabus. So in that there is unit 1. Okay, in unit 1 you are going to study about introduction of nursing. So, introduction of nursing. So, in this chapter, you are going to study what is nursing, what is health, what are the characteristics of nurse, what are the qualities of nurse, what are the ethics of nurse, what are the principles of nurse, right? So these are the things you are going to study in introduction of nursing, because you are going to become a nurses, right? So you are going to become a upcoming nurses. First, you have to know the basic sense, like what are the discipline you have to follow, what are the qualities you have to follow, what are the rules and regulation you have to follow. Everything you have to know before stepping into the nursing field. Coming to the next unit, unit 2. Okay. In unit 2, you are going to study regarding nursing care of the patient. Right? As a nurse, we are going to provide the care for the patients. So we are going to administer the injections, we are going to administer medication, we are going to feed, we are going to do so many procedures, bed making, right? So these all things you are going to study in this chapter. So how to care the patients, because as a nurse we will experience so many types of patients in the hospitals, right? So fracture patients will be there, mental patients will be there, and cancer patients will be there. Every patient is not requiring same type of treatment, right? I think you all know regarding this. So the mental patient require different type of treatment, the cancer patient require different type of treatment. Based on the disease condition, we have to give the care for the patient. So in unit 2, you are going to study regarding what are the care you are going to give for the patient. And coming to the unit 3. In unit 3, you are going to study regarding basic nursing care and need of the patient. So when the patient in the hospital, the environment is very different, right? The house environment is different and the hospital environment is different. So everyone will not feel happy to stay in the hospital, because hospital means everyone have fear. Oh, the doctor will come, nurse will come, they will give the injection, they will do the painful procedures. So you have to understand the need of the patient, you have to provide comfort, right? So there are so many comfortable devices like pillow is there, bed rest is there, restraint is there. So regarding these comfortable devices, you are going to study in the unit 3. Okay. So this is about unit 3, that is basic nursing care and need of the patient. Coming to the next, unit 4. In unit 4, you are going to study regarding hygiene. Everyone know regarding hygiene, how to maintain hygiene, how you have to be disciplined, right? So the patient also should be in the hygiene. So if you are having good hygiene, so you can prevent so many diseases. So you have to focus on maintaining the hygiene. You also should maintain hygiene, patient also should maintain hygiene. How you are going to provide hygiene? For example, bed bath you will give, bed making you will do, and you will do hair care, body bath. So these are the things, nail cutting, hair care, combing. This is the things you all comes under hygiene. And in the chapter unit 15, sorry, unit 5, in unit 5 you are going to study regarding assessment of patient. In assessment of patients, you know, I think when you are going to clinicals, you are studied regarding assessment like objective data, subjective data, and assessment, diagnosis, and evaluations, right? So in assessment of patients, there is subjective data and objective data. The subjective data means the data which is collected by the patient, and coming to the objective data means the observation. On observation, what the data you are going to collect, that's all comes under objective data. So in unit 5, you are going to study about how to collect the history of the patient. And coming to the unit 6, in unit 6, you are going to study regarding infection control. So, as a nurse, you have to control the infection in the hospital, because the nurse is the main key or main chain of the transmission of infection from one patient to another. So she is handling more patients. So she is touching one patient and again she will go with another patient and she is using same injection. So everything there is a chance of spreading the infection from one patient to another. So as a nurse, how you want to control the infections? Like hand washing procedures and what are the drugs you have to wear, what are the precautions you have to take. These are the things you are going to study in the unit 6. And in unit 7, you are going to study the therapeutic nursing care and procedures. So, like feedings will be there, nasogastric tube feeding will be there, bed making procedure will be there, injections. There are so many several routes of injection. So, these are the things you are going to study in the unit 7. And in unit 8, you are going to study regarding introduction to clinical pharmacology. So the pharmacology is nothing but the study of the medicines, right? So in unit 8, you are going to study regarding some medicines, which are the medicine used for which disorders. That thing you are going to study in the unit 8. And coming to the next one, first aid. So first only I told in nursing foundation subject, it involves the fundamental of nursing and another one is first aid topic, right? So the now we are going to study regarding first aid syllabus. So you all know first aid means when we are in emergency, when you are getting fracture, when there is an accident, you are going to provide the first aid treatment for the patients, right? The first aid is given in schools for children, and first aid can be given for accidents and any emergency situation. So, as a nurse, if you are going somewhere suddenly in bus or suddenly in roadside, some patients is needing any emergency help, you have to do the first aid treatment for them. So, if you are giving first aid treatment, you can save the life of the patient. So, in first aid syllabus, you are going to study regarding introduction. In unit 1, you are going to study regarding introduction of the first aid. It means what is the definition of first aid, what is the purpose, how to do, what are the things you have to involve in the first aid box. Everything you are going to study in unit 1. And in unit 2, you are going to study regarding the procedure. Means you have to know, right, how to do the first aid treatment. Like first you have to apply the betadine and you have to clean the wound. You have to apply the betadine. Next you have to do the bandage. Next you have to shift to the hospitals. So if there is a fracture patient, first you have to immobilize the body part. Then you have to do the first aid. So these are the things you are going to study in the unit 2. And in the unit 3, you are going to study first aid in emergency. So emergency situation like accident, poison, or some snake bites, dog bites. So during dog bites, what you want to do? You want to wash the wound area. You have to take TT injection. And if there is a poison patient, you have to make the patient to do vomiting. There is any cardiac arrest, you have to give the CPR. So these are the things. What are the emergency conditions you are going to face? You have to know how to give the first aid treatment for that emergency situation. So these are the things you are going to study in Unit 3. And coming to the last, Unit 4, you are going to study regarding community emergency. Means community means it is a group of peoples. So in village there is so many peoples. Suddenly flood will happen. Suddenly tsunamis will occur. Earthquake will occur. So many peoples will get damaged by the tsunamis, floods, everything. So, as a nurse, you have to move for that place and you have to give the first aid treatment for these peoples. Okay, so these are the things you are going to study in the Unit 4 chapter. Okay, so this is all regarding the syllabus. So now we are going to study regarding what is the question paper pattern you are going to write for the nursing foundation subject. So you are going to write the exam for 75 marks. Okay, so for 75 marks, first you are going to answer, give the meaning of the following. Means they will give one word. Like for example, they will ask define nurse, define CPR, or define disaster. So they will ask for one question, one line or two line answers. So that you will be asked for four marks. So in first heading, first main, you are going to get 4 marks. You have to answer only in one line or two line. That is enough. If they ask what is define nurse, you have to write the definition of nurse. That is enough. No need of writing characteristics, qualities, ethics. Okay. So in first heading, you are going to write regarding give the meaning of the following for 4 marks. In that, they will be asked A, B, C, D. You have to write in one line or two line. So you can easily get 4 marks. So the next second heading, you will get fill in the blanks. Okay, so fill in the blanks, they will be asked for 4 marks. So you will be having 4 questions in the fill in the blanks. So they will ask the sentence and they will give one dash and you have to fill that. Okay, so you will get 4 marks easily by writing fill in the blanks. So in fill in the blanks, like if you are having any textbook, if you are reading any exams, at the last of your page, they will be given fill in the blanks, multiple choice questions. So the question may be come by these topics only. So focus on the fill in the blanks and meanings of the following. So because you can easily get marks by this, because no need of writing long answer or long essay, right? So with easy word within a fraction of minute, you can get 4 marks by attempting the fill in the blanks. So the next one, write short notes on any four of the followings. So you have to write the short answers. Means for 4 marks, you have to attend 4 questions. They will ask 5 questions, but you should write only 4 questions. Okay, one questions you have to leave. In 5 questions, you have to attend 4 questions. You will get 4 marks for one questions. So total marks, how many marks you are going to get? 16 marks you are going to get by writing the short answers or short notes. So coming to the thing, the sheet management. So now you are in by this heading, you are going to start the theory answers, right? So for 4 marks, you have to write 2 to 3 pages is enough. No need of writing 5 pages, 10 pages. Okay, just 2 to 3 pages is enough for getting 4 marks. So in this, you are going to 16. You are going to get 16 marks. Next one, answer the following. So this is for long answer. Okay. So they will ask in the two questions, sub questions like A and B. In answer the following, you have to write the answer for A also and you have to write the answer for B also. In A option, you will get 2 marks. And in B and question, you are going to get 5 marks. So total marks you are going to get by this is 7 marks. Okay. For example, how they are going to ask define nurse in the question number A and write the qualities and characteristics of nursing in the question number B. Like this, they are going to ask. In A, they will ask the definition, and in B, they are going to ask any procedure. Another example, like in A, they are going to ask what is nasogastric tube feeding. Define nasogastric tube feeding. So if you are writing the answer, you will get 2 marks. And in the B, they will going to ask regarding procedure of nasogastric tube feeding. So by that, you are going to get 5 marks. Total, you are going to get 7 marks by this question. And the next one is state whether the following statements are true or false. True or false questions they will be asked for 4 marks. You are going to get 4 marks by true or false. Just you have to mention whether it is a true statement or whether it is a false statement. And while you are attending true or false question, no need of writing questions. If you are writing question, you can't manage the time. That is the waste of time. So just you have to mention whether the question is true or whether the answer is false. That is enough. Okay. So by the true or false, easily you can get 7 marks. True or false question will be for 4 questions will be there. So for 4 questions, one marks will be allotted. So by this you are going to get 4 marks. And the next one is fill in the blanks. Okay, in fill in the blanks, they are going to ask for 3 questions. One marks is allotted for 1 question. That is for 3. Right. So in question paper, they will be mentioned section A and section B. So the section A, the question will be come from fundamental of nursing syllabus. Okay. And in the section B, the questions will be come from first aid syllabus. Okay. So you have to concentrate on both the topic. You should not do negligence for first aid topic or you should not do negligence for the fundamental of nursing topics. Same importance you have to give because you also getting marks by fundamental of nursing also and you have to get marks by first aid also. If you not studied first aid topic, then you can't pass by writing answer for fundamentals. So both topic also you have to concentrate. Okay. So the next thing. Okay, the next thing is write short notes on any four of the following. So here they will ask 5 questions. So you have to choose 4 questions. The questions which are easy for you, first you have to choose that 4 question and you can write the answer for that 4 question and you will get 4 marks for that. So by attending 4 questions, you are going to get 16 marks. And the next one is answer the following. In answer the following, say they will ask A, B, and C. This is for 7 marks. So in A, they will ask the definition, and in B, they will ask like purpose or characteristics for 2 marks, and in the question C, they will ask for 4 marks. So when you are starting to write the exam, first you have to note how much marks is allotted for the question. If they are allotted only 1 marks, you have to write only 1 to 2 lines. No need of writing 1 page, 2 page answer. If they are allotted 4 marks, you have to attain 2 to 3 pages. Depending upon the weightage of marks, you have to answer. So the main thing you have to see how much marks is allotted for question numbers. Okay. So the next one. Okay, so if you want to pass in your nursing foundation exam, don't concentrate only on the theory. You have to concentrate on practical exam also. I think you people all know that if you are passed in theory exam, but if you failed in practical exam, then it is not considered as a pass. If you failed in practical exam, if you also passed in theory, then they all considered as a fail. Okay, if you want to pass in nursing foundation subject, you have to focus on the theory exam also and practical exam also. If you passed in practical exam, if you failed in theory, then also it is considered fail. If you passed in theory and if you failed in practical exam, then also it is considered as a fail. So both you have to concentrate and both you have to study. Next one. Okay. So in today's session, we discuss regarding how we need to prepare for the exams. That is like first time you are writing the exams. So first time you are writing exam means first you need to know what is the weightage of mass, how the question paper pattern will be there. So you have to solve some model question paper. Okay, you if you are solving model question paper, you will get some ideas. So how much marks we have to answer, how much sheet we have to write the answer, and how the marks is divided, how much short answer will be there, how much long answer will be there. You will get some ideas. So, and you will come to know some important topics. So, you have to study like previous question papers, at least 10 years. So, 10 years previous exam question paper you have to solve. So, easily you can pass your exams. Okay, so you have to solve the model question paper, you have to solve the blueprint, and you have to solve the previous question paper also. So this is about the exam pattern question papers, what I was discussed. So if you have any,
Thank you, Shubha. Now it's time to clarify all your doubts. Did anyone have any doubt regarding this topic? You can ask this section. You can utilize this section. Before that, I'll tell you one thing. There's a note downloaded the Nursing Guru app. Please download it from Play Store. You will get all nursing requirements, syllabus notes, video classes, and previous year question papers. So please download Nursing Guru application from Play Store. And this time is yours. You can utilize this time. If you have any doubt regarding this, you can ask to Shubhama. Nothing was there. We can wind up the section.
ma'am, when is the exam date?
Exam date was not declared, and we will inform you.
Thank you, ma'am. See, if you are not install Nursing Guru app, you can install the Nursing Guru app because every students cannot attend the classes regularly, right? So if you are not attending classes, so you can miss the topic in the class. If one topic is not understand, then you can't understand next topic. So if you are installing the Nursing Guru app, so you can easily learn any topic you are facing difficulty or any topic you have doubt. So everything you can learn in Nursing Guru app. Any doubt in the question paper pattern or regarding marks, regarding any tips?
There was no doubt we can wind up the session. There was a എന്തപ്പോ അതല്ല if there was no doubts we can wind up the session. 5:44
Can anybody answer what are the tips I told for nursing exam?
question.
Anyone try to answer what are
Digila,
the tips I told regarding nursing exam?
Please respond.
Everyone is responding in message. Anybody try to answer?
അതിന്റെ തൊണ്ട് സ്ലൈഡിന്റെ തൊണ്ട്
Sheet management, read question paper, mark management, time management, attention to question paper, question number and serial orders, and diagrams.
Yeah. Okay. Anybody have any doubt?
ഞാൻ അതിന്റെ ഒക്കെ ചെയ്തേക്കട്ടെ അതെങ്ങനെ ചോദിക്കുന്നേ അതെങ്ങനെ ചോദിക്കുന്നത്
If you don't have any doubt, we can wind up the session. Before that, anyone have any suggestions regarding the class or next topic info?
If guys you don't have any more doubt about this topic, we can now wind up the section. And before that, if you want if you have any suggestion regarding the next topic, you can also tell now.
Ma'am, question ensure serial.
Sorry, once more. Sabita, once more.
Ma'am, I asked some question that I one or two question that one question is I can write, but two question I can't write. After that, three question if I can in matlab if I write, then two question is um two question is can't write, and that तो मतलब वो क्या करेगा वो
Yeah,
टू
yeah,
क्वेश्चन
Sabita.
हाँ
I understand your doubt. So yeah, you can write that. So you are telling you know the first question answer, but you don't know the second serial number answer. So you can
यस
write the
मैम
third question. Yeah, you have to mention the question number properly and you have to write the answer. Okay,
ओके
it is
ओके
not
मैम
a
ओके मैम
problem. It's not a problem. You can just write the question number and you can, but try to write the answer in the serial number because when you are writing in one page one question answer and you are moving to the last question number, so the evaluator also will get some confusion. Okay, so to avoid this, try to write in the order way. So if you don't know the answer, you can skip the answer and you can write the next question. That
ओके
is
मैम
not a
थैंक
problem.
यू
Okay.
थैंक यू मैम
Okay.
any more doubts
Any more doubts?
any more
Anyone
doubts
have any more doubts?
No, ma'am, no doubts.
okay
Okay.
anyone
Anyone
have any
have any
suggestions
suggestions
about the
about the
next
next
topic
topic?
Ma'am, I have one doubt.
Yes.
Uh, in the first main, so we knows the first answer and second answer. If we don't know the third answer, means we can leave the blank there, or we have to fourth question we can continue.
ലെഫ്റ്റ് ആയോ? അപ്പു പറ ഇല്ലേ?
Ma'am already answered this question. No, not like that. I'm not like that. I'm asking. So order wise we have to write, right? So that one I'm asking. If we don't know the question means we have to write the number and leave the blank, or we can continue the next answers.
See, if you don't know the answer, you have to not leave the space. Okay. So if you want to write something like some students will be there starting, we can't remember the answer, but last 5 minutes I can remember the answer and I can write the answer. So if you are able to write the answer, then only you leave the space and you can move to the next question. If you don't know that regarding that question, if you don't able to answer means no need of leaving the space. You have to move for the next question. Okay, got it?
Okay, ma'am, I got it.
Uh,
Thank you, ma'am.
Any other doubts?
Would you have any suggestion about our next topic?
Yes, ma'am. How many pages fulfill for 7 or 8 marks questions?
Sorry, it's
Sorry,
not
it's not audible.
How many pages fulfill for 7 or 8 marks questions?
എനിക്കൊന്നും മനസ്സിലായി.
Rumi, we can't hear your question. Some disturbance is there. Rumi, can you repeat the question?
How many pages fulfill for 7 or 8 marks questions? I mean full questions.
See, for 7 marks or for 8 marks questions, they will be subdivided, right? So as A, B, and C. So first question for 1 marks, and B question is for 2 marks, and C question will be for 4 marks. So for A question, you have to write for 1 line or 2 lines, and for B question, that is for 2 marks, right? So you have to write for like only purpose. So 1 page is enough. And for 4 marks question, you have to write for 2 to 3 pages. So what I'm telling is, when you are writing the answer, first you see the allotted marks. Okay, so if you are seeing the allotted marks, you will come to know how much page answer is needed. So 1 marks question, there is only 1 line or 2 line is enough. So 2 marks question, so 2 to 3 line is enough. So 4 marks question, you have to write at least 2 to 3 pages is enough. So you can get 7 marks.
Okay, thank you.
Any other doubts?
Hello.
Somi, did you have any doubt?
No, ma'am.
Okay. If no one have any other doubts, we can wind up the section. And once again, I repeat, if you have any suggestion regarding our next topic, you can tell your suggestion. No suggestions? Okay. Now it's time to wind up the section. Once again, thank you so much, Shubha ma'am, and also thank you everyone. Now you can leave this meet.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you.